The Philippine Statistics Authority reported an increase of teenage pregnancy in 2022. Based on their latest data, around 3,000 girls aged 14 and below gave birth to a baby.
Now that's why concerned agencies and groups are pushing for the Senate to expedite the approval of the bill addressing teenage pregnancy. To talk more about this, we have Shebana Alqaseer, Technical Advisor for Adolescent Sexual Reproductive Health Rights of Save the Children Philippines. Good day, Vance.
Can you hear us? You may turn on your camera.
And your audio as well?
So that we can talk about the teenage pregnancy here in the Philippines. Kasi apparently, Diego, there's an ongoing anti-teenage pregnancy bill here in the Philippines. I'm not so sure lang about the details, pero nakabinbin yan sa Senate at saka sa House of Representatives. So I don't know lang saan na sila in terms of crafting the bill, of passing the bill already. Pero yun nga, there's an increase of teenage pregnancy and it would, age from 14 and below. Talagang nagpapaanak pa. And what's more concerning about this is yung mga matatanda, medyo older women ang mga nagfa-father dito sa mga batang nabubuntis.
Anong binibenta nila?
We don't know about the story, pero usually yun nga mas matatanda. Siguro yung iba biktima ng rape, yung iba we have yet to discuss that nga, kaya nga nandito yung sa Save the Children kung saan ang gagaling yung report nila. And there are cases also in several areas in our country na hindi rin nare-report.
And then this bill, sorry kasi
pregnancy.
I read it in passing. We can talk about it na lang, no? We have with us on the line via Zoom.
Yes.
Yes, good morning. Thank you very much for joining us here on the One News.
Hi, good morning, Angela and Angelo.
Okay, so of course, ang ating unang katanungan, ano ba yung mga possible factors behind the rise of teenage pregnancy here in the Philippines?
Sige, mahalaga nga na unang-unang tanong yan, no? Madaming dahilan. Ang una, siguro, masasabi ko, sa 15 to 17 years old.
Go ahead.
Okay. Sa 15 to 17 years old, mga older adolescents, ang kaso ay siguro kakulangan talaga ng impormasyon tungkol sa sex, sexuality education, how do you keep yourself protected, and syempre wala pa ding access yung mga adolescents sa contraceptives without parental consent. So yung open and safe communication with their families para makahingi ng tulong at gabay, ay may barrier pa din doon. Pero ang nakaka-alarma ay yung 10 to 14 years old. Yeah. Kasi hindi ko ma-imagine yung 10 years old being pregnant, di ba? I'm sure kayo din. So ang nakita sa research, bukod sa 35% ang increase ng 10 to 14 years old, ay karamihan ng mga kasong ito ay dahil sa pang-aabuso at coercion.
Yeah, do you think the number of yung mga datos na inalalabas nila about teenage pregnancy in the country, is it underreported? Is it accurate?
Ang masasabi ko, hindi sa underreported, but I think right now we have better data collection.
Okay.
Unfortunately, in the past, sa surveys natin, halimbawa sa Philippine, sa PSA, ang data natin ay 15 to 49. That is what is covered by our surveys. So yung 10 to 14, absent siya sa ating data. So manually yan kino-collect. Hindi naman siya underreported, hindi lang siya maybe properly collected. So ngayon nakikita natin na madami pala. Pero palagay ko din, one thing that also happened is nung nag-ease the restrictions ng pandemic, we saw a decline during the pandemic because of the lockdown.
Yes.
But now na open na ulit, nag-i-increase din talaga.
Alright. So, can you tell us more about this anti-adolescent pregnant bill? Ano bang nilalaman nito? 'Di ba? Para saan ba 'to? Ano bang gagawin niyo? And what do you think about this?
Yes. Actually, we were just in a press con yesterday, no, organized by Save the Children with Oxfam and Young Fem. At andun ang DepEd, CWC, Popcom or CPD na ngayon, and civil society. In one of the statements, no, it was coined the best version of the bill. And in fact, sabi ni Yusek Angelo Tapales, it is a landmark legislation in the making. For us at Save the Children, this is a very important bill, the anti-pregnancy prevention bill, because one, it solves yung mga gap na sa ngayon without the law ay hindi pa ma-implement, no? I can share maybe 4 key points of the bill. First is to ensure the comprehensive sexuality education that is age appropriate, development appropriate, and culturally sensitive. So, ang ibig sabihin nito, hindi naman natin basta-basta tinuturuan lang yung mga bata tungkol sa sex education.
Yes.
Nagsisimula yan sa mga mas basic, mas simple, like good touch, bad touch, di ba?
Okay.
Consent at a younger age. Kasi kailangan holistic siya. At
Yeah.
kailangan hindi lang siya implemented sa eskwelahan, kundi pati sa tahanan, sa community, lalo na to also cater to out-of-school youth. And in fact, the bill also states that hindi lang adolescents ang kailangan ng CSE. In fact, even parents need to know about this information so that they can also guide their children. Pangalawa po, napakahalaga ay to make sure our government mechanisms are properly budgeted and implemented, no? So yung holistic approach, making sure may collaboration through a council, lahat ng agencies involved, including DSWD, NYC, etc., ay mabubuo dahil dun sa batas, no? Pangatlo, napaka-importante din for me, how do we also provide support to already parents, adolescent parents, hindi lang mother, but also their children, di ba? So yung social protection for them is very important, not just in terms of health and social protection, but also legal in cases of abuse, for example, or education, that they can continue school, or TESDA, pati yung TESDA factor na may employment pa sila after kasi hindi naman pwedeng mahihinto na yung buhay nila because of what happened to them. And lastly, syempre, yung medically accurate services, not just information. So, ngayon, 'di ba, dahil sa RPRH law, kailangan ng parental consent ng adolescent 15 to 17 years old. Can you imagine, even if you're already a parent, kahit magulang ka na, kailangan mo pa ng consent ng magulang mo to access contraceptives. And we want to avoid repeat pregnancy kasi doble pa yung burden. So for this, as long as may trained, in consultation with a trained health professional, dapat yung mga 15 to 17, allowed na sila to access contraceptives that is best for them if needed. Kung lang sexually active na sila, nabuntis na sila, nanganak na sila. So yun yung 4 key points na I think ma-address ng bill.
Right. This bill also focuses doon sa papaano kumbaga ititreat kumbaga i-handle itong mga teenagers na pregnant moving forward, kasi there was a notion before na kapag buntis ka hindi ka na pwedeng mag-aral ulit, 'di ba? Parang mag-alaga ka na lang ng anak mo, parang wala ka ng future. Can you tell us more about it?
Yes. So, ang isa sa mga inaayos natin ay mawala yung stigma and discrimination. At hindi lang yon, yung mapsuportahan din sila, no? So, kasama dito yung pagtanggal ng mga requirements sa paaralan. Alam natin may mga ini-expel pag nabubuntis. But even without the expulsion, alam mo yung barriers na may multiple burden ka na kailangan mong i-prioritize ngayon yung pag-aalaga ng anak mo. And in fact, you're also a child. You also have rights.
Yes.
Right to study, right to play, right to also enjoy life. But now you are burdened by this, nalilimitahan yung opportunities mo. So ito, magbibigay tayo ng mga specific support. Halimbawa, actually ginagawa na to ng DepEd with their Matatag. Kung may alternative learning mode, 'di ba, para kung kailangan nila ng extra accommodation and support to still finish their schooling kahit nag-aalaga na sila ng anak. But we are also encouraging in the bill shared responsibility.
Right.
Hindi lang dapat to burden nung adolescent mother. Syempre kasama din yung kanyang partner, as long as of course it's a consensual relationship, pati na din yung role ng kanilang magulang sa pag-provide ng support, no? And then yung nabanggit ko nga kanina, opportunities like for TESDA, for employment, for life skills, mahalaga ito. And then, the psychosocial support. Because being a mother, I am not a mother, but I am afraid to become a mother because of the responsibilities and burden. So I know that it would impact anyone. What more an adolescent if at a young age you will be given this responsibility.
Right.
So yung emotional, psychosocial support is also important.
How about yung I'd like to touch up a little bit about yung partners who have abandoned these teenagers, no? Kasi iba naman yung usapan sa 10 to 14, that's technically, that's already rape. But let's talk about you mentioned the older ones na almost the same age with their partners and they abandoned. Wala ba tayong mechanism in place right now in this country that would hold some level of at least financial accountability for these teenagers who get pregnant?
Yes, that's true. Balikan ko lang din yung sinabi mo, no? You are right. Even for 15 to 16, because our age of sexual consent has been raised to 16 years old, dati 12. So kung ang partner ay older, talagang meron na tayong mechanisms to hold them accountable, no? It's considered rape kahit po may relasyon sila. Because of the age gap, no? Lalo na kung past 3 years ang age gap, kahit 16 at 20 years old, considered pa din po yan na rape.
Yeah.
And dun sa naman po sa responsibility, kasama talaga, no, ang responsibility ng parents, ng magulang, to provide for their child at pwede pong i-hold into account at makasuhan para makapagbigay ng suporta. Siguro mahirap lang po, mahirap lang din pong i-demand yun, no, kung pareho din silang bata.
Yes.
At alam natin, it is also sometimes the case. Of course, madali nating mahahabol, hindi lang for financial support, but legal criminal case kung
That's right.
older, no, ang partner. Pero ang problema kung pareho silang bata, 16 years old, 15 and so on, mahihirapan talaga to also hold another child accountable for that, especially kung legally or criminally. What we really can provide is support, no, as a community, not just their parents and their family. Alam natin, yun yung nangyayari din po. Sorry to jump in and change the topic, but ang pinakamataas po na reason for out of school dropout ay for girls ay family matters, usually because they become pregnant, and for boys because of employment. So yung kailangan mo nang magtrabaho kasi wala kayong pera, yun ang dahilan ng dropout ng mga lalaki at pagbubuntis naman sa babae. So kailangan talaga community, it's a whole of nation approach talaga. Kasi ang iniisip ko nga yung impact talaga nito, sino ba ang pinaka-maaapektuhan ng maagang pagbubuntis? Hindi ba yung mga pinaka nasa laylayan, sabihin na natin, no? If you're in a low-income household, how can your family provide support to you if you become pregnant? If sabihin na natin you're from a privileged, position, middle income or upper middle income, yung magulang mo, they can take on the responsibility. Pero kung low-income household kayo, mahirap, no? Mahirap talaga yung sitwasyon. Kailangan na ng intervention ng government.
Vance, no, kanina kasi you mentioned there are several factors talaga behind the increase nga ng teenage pregnancy here in the Philippines. And one of which that we can also check is yung access to online ng mga kabataan, yung easy access nila, no, to online, and most importantly yung pornographic content online na na-access nila na madali. How do you think this bill will help, no, para ma-lessen yung or kumbaga ma-eradicate din, no, kung posible itong easy access sa pornographic online ng mga kabataan?
Siguro yung dalawang bagay. Tama, no? In fact, according to the Young Adult Fertility Survey, adolescents get their information about sex and sex ed online or through their peers, no? So, ang isa nating approach dyan, even actually without the bill, halimbawa sa Save the Children, how do we infiltrate these spaces like social media? How do we do a scientific research, halimbawa, on what is the effective way to change behavior of people? Ano ba yung interesting to them, 'di ba? If they are in TikTok, if they get their information on TikTok, maybe we should be there, 'di ba? Maybe government intervention should be made easily available online through TikTok, Facebook, ganon. Second, no, actually hindi pa siya covered ng law, pero naalala ko nabanggit ito ni Asek Galban kahapon dun sa press con. Asek Galban is a DepEd Assistant Secretary. Sabi niya, sa dami ng mga agencies natin, not one agency is involved, is mandated to monitor and hold the online platforms accountable.
Yes.
Walang nakatutok dyan, no? Pero meron naman tayong cybersecurity, di ba? Yung OSSAEC, anti-online sexual exploitation and abuse of children. Pero yung regulating online content, kulang pa. And I think cybersecurity is becoming a very important aspect of everything that we are doing.
Correct.
We have to make sure hindi lang yung monitoring what adolescents are accessing, but holding social media platforms accountable. You know, in safe spaces law, meron naman, di ba, covered ang online space, but it is so hard to have cases reported. Halimbawa, yung hindi naman unwanted yung consent. Walang consent ko, in-upload yung material ko, for example, my photo or my video, etc. It is so hard to track, to have it taken down, kasi ang bilis din ng movement. Tapos walang responsibility, walang accountability yung ating social media platforms. And I think that is a separate law entirely, not just for adolescents, but to protect the safety and security of every Filipino, even online.
Okay, sige. Maraming salamat po sa inyong oras. Hopefully, we can invite you again to discuss more matters about saving the children. But thank you so much for your time, Shebana Alqaseer.
Thank you din po.
All right. She's a technical advisor for adolescent, sexual reproductive health rights of Save the Children Philippines.
Pero tama siya, ha? Dati kasi you'll say everything begins at home, but there's also the second factor now. Kasi for some families, home is social media space. Diba? So it's the safeguards of social media. Sabi nga nila, your parents, you maybe access them 6 to 8 hours in a day on the average, but social media is with you every hour, diba? With every child, every hour. So how do you regulate that pag malayo ka na sa magulang mo?
Oo.
Kasi if you have internet sa bahay, may safeguard yan eh.
Pwede
Parental
yan.
lock yan eh. Oo, pero
Sa school, di naman sila pwede gumamit ng
hindi
mga
pwede.
Pero when
In
they're
between,
out,
in betweens are the important thing we have to look at.